Welcome, everyone. Welcome to What Can I Do with My Allied Health Sciences degree? My name is Megan Veltri. We're going to get started in just a moment, but we're still having some people enter the Zoom room. While you're waiting, if you wouldn't mind clicking on the QR code, so using your phone, take a picture of it, and then you can go ahead and log in to our presentation today. So we'll get started in just a minute. All right, Steph, you think we're ready to get going?
I do.
All right. Well, okay, my name is Megan Veltri, and I'm one of the career advisors from the Career Center.
And I'm Stephanie Dombrowski Jensen, also the Career Center.
All right, and we're just going to go ahead. So today we're going to be talking about what you can do with your Allied Health Sciences degree. We know that there are probably a lot of students here at different points in your career, your academic career. So you might be a first-year student, or you might be already about to graduate this December, and you're wondering exactly how you can apply your degree different ways. And so we'll be talking about that today. We're hoping to include a lot of resources for you all. And then of course, at the end, if you have any questions, hopefully we'll have some time for questions, but also you can connect with the Career Center. So Stephanie and myself are two of the advisors from the Career Center that work with health sciences. Also on the call today, we have Rachel Becklin. And Rachel is one of our internship coordinators. And then also Alicia Davis from the Allied Health Sciences Department is here as well. So Grace, if you want to go ahead and go to the next slide. All right, so we'll talk a little bit today about why you might be here. So thank you very much for attending. There's probably a variety of reasons why you're here, but we're guessing you might be here because you're considering maybe allied health as a major. So maybe you are considering changing to this major. You could be undecided, or maybe you're wondering if it's the right fit for you, and maybe it's not feeling like that and you're considering some other options. That's okay. You are currently an allied health sciences major and you want to learn about professional development and career opportunities. So maybe you're in that sophomore junior phase and you are ready to start getting some professional experiences and not exactly sure how to obtain those. You'll learn about that today. And then you're planning on going to graduate school and want to be prepared if you change your mind or if you're not admitted. And so we'll have some parallel planning options available for you today. And then your career plans have changed and now you're not exactly sure what's next. So this can happen. So maybe you're an allied health sciences major and your whole plan was to go to physical therapy school. And now you're wondering that might not happen for you for whatever reason, or it could be a different path that might not happen. We're happy to help you to explore other options. Your allied health sciences degree can be applied in a variety of ways. We'll talk about that today. You can go ahead and go to the next slide. Okay, so we'll be talking about clinical and non-clinical options today. And so we just want to be clear the difference between, we're going to be using the terms clinical and non-clinical. Stephanie and I will be using those today. And so what we are referring to is with the allied health sciences degree, there's kind of two routes within healthcare that you can go. And so when we use the term clinical, we're using the term direct patient, or we're referring to direct patient care. So you are working directly with as a healthcare provider with patients. So those of you who are interested in PA school, maybe you're interested in OT, PT, you might be considering other career paths, sonography, nursing, things like that. Those are considered clinical direct patient care roles. And then there's also non-clinical roles. And so what we mean by non-clinical is that you're still helping to support patient care, but you're not necessarily doing the direct diagnosis, treatment, or care for the patient. So you'll often hear this referred to as like an administrative position where you could still be working with a healthcare or a healthcare organization or a hospital, but you're in a non-clinical administrative role. Right. So if you are thinking about going the clinical route, the allied health sciences degree prepares you very well to transition into clinical routes, but there's no clinical training in the allied health sciences general degree. And so you would want to be looking for opportunities where you could find clinical training after earning your degree. So if you are considering, a lot of students are allied health sciences and they might be pre-PA, pre-PT, pre-OT. So a lot of them are thinking about going on to graduate school after their undergraduate degree. So graduate school is a place where you can get some of that clinical training. There are other options as well. We know accelerated nursing programs are sometimes popular with allied health sciences majors. You might also be considering a post-baccalaureate program, and those can be pretty specific. So we encourage you to talk with academic and career advisors about those options. We also have community college clinical programs. So let's say, for example, you are thinking about going to school for dental hygiene. Grand Valley doesn't have dental hygiene, and so we would encourage you to look at some schools that do have this option. So for example, community colleges have this option. Or if you're thinking, you know, I wasn't able to get into a clinical program at Grand Valley, I'm looking at other options. Community colleges can be another place where you can find some of that clinical training. And then if you're just exploring clinical career paths, like you're thinking, okay, I'm interested in a clinical career path, but I want to start doing some career research first. Some of those resources that you can look into are websites like Explore Health Careers. Some of you might be familiar with that through your classes, or maybe you've done some career advising where we've referred you to this resource. Informational interviews and job shadows. This is where you're talking with professionals. Informational interviews don't take place on site. They can kind of happen anywhere. They can be formal or informal, and you can reach out to people in the field. And then job shadowing is when it's actually on site and you get to observe a professional in their workspace, which is an awesome opportunity, but we know that that's been a little bit harder to obtain with COVID. So I am going to drop some resources in the chat to help you navigate informational interviews and job shadowing. But then other great places with COVID, with the job shadowing and the informational interviewing not being as available, part-time jobs have been a great place where students have been able to get some healthcare experience, and it's always nice to be paid, right? And so we've been encouraging students when you can to get part-time jobs, and employers are getting a little bit more flexible because they're in need of students. So if you are concerned about your schedule as a student, that might be something that the employer is willing to work with you with. And then also gap years. So some of you might be graduating and thinking, I need a year or so after graduation to kind of figure out what's next. And that is really okay. And actually a great opportunity to work in the field, gain experience, and strengthen your application.
All right, I'm going to be talking more about those non-clinical jobs. And you may be thinking, how do I get started? Or you may not even be thinking non-clinical because your path right now is clinical. But sometimes it's good to have this background information just as kind of a backup plan or a parallel plan, just in case you may not get into that program or, change your mind about your career path. So I'm really going to be focusing on 4 areas. We're going to identify healthcare environments. We're going to look at employers. We're going to learn some job titles because people always want to know what's a job title I can do with allied health. And then we're going to utilize some strategies and tools to help you kind of figure all that out. So Grace, you want to go to the next one? So we're going to be looking at some of those non-clinicals. So we typically think of healthcare as hospitals, but we know that there's a big footprint in a lot of different areas that have that impact in healthcare. So for instance, I'm going to kind of go through some of these insurance companies. We know Priority Health and Blue Cross Blue Shield are pretty big in Michigan. And I looked at Priority Health today, and they have a lot of customer service type roles where you may be educating a consumer on a product, helping them make decisions. We have nonprofits. The nonprofits are really any organization that's doing something for the social good of the community. So there's nonprofits, could be a kid's food basket or even something within animal shelters, or really anything, again, helping that community. So I look at that as human services. It's not in a hospital setting, but you're still helping people. And then we talked about hospitals. We're all familiar with that one. Medical device companies and pharmaceutical companies are sometimes themes that we hear students want to do, but they automatically go to thinking about doing sales. And we were surprised recently when we met with a medical device company called Stryker and got to know them a little bit, that they have a lot of unique opportunities. And one in particular, it is a customer service role, but you're actually in an operating room and you're helping support a physician. So we worked with the endoscopy division, in which they have cameras. And so you may be in an operating room with a physician doing a procedure with a camera, and you're kind of there as the most ultimate customer service rep. So if something goes wrong with that camera, or that physician is having to change out something, you are there to assist them. So it's customer service. You're in an operating room, but it's hospital and clinical related, and it's not sales. So again, we tend to think medical device and pharmaceutical as sales, but there are a lot of opportunities within those organizations. Even pharmaceutical companies, they typically like their employees that want to do sales, maybe to start somewhere in an entry-level position. Maybe you're working in a lab environment, you get to know a product, you get to know their culture, and then you can grow within those organizations. So it's always a great place to start, is in with those entry-level positions within those organizations. Residential care facilities, we know that there's a lot of allied health doing maybe behind the scenes, administrative, they're maybe help managing a team, maybe they're recruiting for people to work in that organization. We have government agencies. One in particular is the state of Michigan Health and I think Department of Health and Human Services. And I took a quick peek at their website today, and they have 12 different divisions. So ranging from, victim advocate to adoption, even administrative tasks within marriage license. So they have a footprint in a lot of different areas within human and health and services. So when you go in there, there's like totally 20 pages of job opportunities. Not all of them are for allied health, but again, there's a lot of them where you're maybe supporting an initiative from public health. Maybe you're helping doing some programming or doing some educating of a product or service that organization may be doing. So again, I encourage you to look at those. And then we're going to switch into informational system vendors. Oops, sorry, go back one more time. All right. Sorry, Grace. Those are like more of the software. Most hospitals are using like Epic and Cerner. And many times if you're an allied health student, you're maybe working in healthcare in some capacity right now, maybe you're a nurse tech and you're familiar with certain software. So a lot of times those vendors have people that help in, sell their product or explain their product to an organization. So then you have already had maybe some experience using that. So that's another entity. Research facilities, one of my favorite ones is in Kalamazoo. It's called Charles River Laboratories. They're doing clinical trials. They're running about 370 clinical trials. They're an international company, but we have a footprint here in West Michigan, and they love allied health. And you don't have to know really anything about clinical trials. These are organizations that will bring you into different entry-level jobs, and you can grow within these organizations. Many of them pay for continuing ed as well. Educational institutions, health departments, and health retail are a couple of the last ones. Health retail could be anything that maybe at a sales position or working with a company that has to do with a product within healthcare. I know we had a student here recently whose mother was a nurse, and then she now is doing defibrillators. So she's helping training hospitals and employees, not hospitals, but the employees in the hospitals, how to use defibrillators, or helping with CPR training. So again, there's touch points within healthcare, even for those that are clinically trained, but maybe want to shift into a different area as well. Okay, now we can move on, Grace.
Oh, Stephanie, I was just going to add, I just dropped in the chat for those of you who might be interested. There's a list of employers Google Doc. And so within each one of those industries that we identified, we just linked to 5 different employers, because we know that usually that's a question that students aren't really sure about, is what employers are available. And we're going to talk more about that, but you'll see that there. And then also our healthcare career community, we'll talk a little bit more about that, but there's also a link to that resource in the chat as well.
Great, thank you. So now for the job postings, because we say, what are those job titles that I can do? And if you're Googling allied health science jobs, you may not get a great result. So this is where you kind of have to think a little bit outside of the box again, and we'll kind of show you some strategies for that. But this is a sampling of some variety of job titles that you probably wouldn't have thought of, or you wouldn't have done a Google search. And the 2 that we're going to highlight here is on-site specialist and the talent acquisition sourcing specialist. The other ones you can click on, but we're going to first start with the on-site specialist at Stryker. I mentioned that kind of already. And this is, again, and I think the one that we bring up here is in Irving, Texas. Stryker is they're actually an international company, but this position is one that every state, pretty much every hospital has this on-site specialist. And this is where you're working with equipment and you are helping those physicians in the operating room. So when I learned about on-site specialist, I knew nothing about it. But I actually worked with a student who was, I think, a BMS, pre-dental, didn't go to dental school. He knew something about Stryker. So we looked on LinkedIn, which we'll touch on a little bit, and we're able to find Stryker and our alumni. So he reached out to an alumni. He did an informational interview, basically asked her what she did, what is an on-site on-site specialist. And a couple of days later, she said, you know what? Send me your resume. And then she passed that on to her hiring manager, and make a long story short, within a couple of weeks, he was hired and in this role now as an on-site specialist. So that all became with that networking. But I want to highlight through here, because this wouldn't be something that you would necessarily look at. And if you saw this, if you want to just scroll down, we'll look at a little bit about the qualifications. So again, this may feel like, wow, this is really overwhelming. I'm not qualified for this, but we can see that really the bachelor's degree is really the certificate or equivalent certification. It's not a specific bachelor's degree. They want you to have a knowledge of potentially medical terminology. And even though you're probably going through here and going, yeah, I don't have experience with clinical surgical support, but you know what? You probably have great, excellent analytical skills, interpersonal skills, maybe problem solving skills. So when you look at a job description, it's simply a wish list. I used to hire for the hospitals and HR, and I can tell you, we would develop like our perfect ideal candidate would meet all of these criteria. Very rarely would we get somebody who matched all of the criteria. So even though you're looking at this and going, yeah, I've never been in the OR, but when we were able to do that informational interview with alumni in a company that we may want to work with, we found out just through that hey, I didn't need to have that OR support. In fact, they trained for like 4 months getting that support and getting that experience. So again, looking at a job description can feel like you're not qualified, but remember, it's simply a wish list, and most candidates don't match all of the criteria. So looking at what you do have from the experiences that you've had, and then your education. What did allied health help me understand? Maybe you had to understand the interdisciplinary of how the healthcare system, or you learned some medical terminology, or maybe you did a project and you collaborated as part of a team on something. So your degree is a foundation that can help you along with the outside experiences that Rachel will talk a little bit about. So Grace, we want to do the talent acquisition one, the next one. So this is very different. The talent acquisition one is more the behind the scenes, we would call it. You're still helping. And this one is for the University of Michigan Health West. And this tends to be a common one that I find a lot of allied health science majors will go into when they don't go on for that clinical. They'll do more of that administrative task. And again, you may look at this and say, I don't even know what a talent sourcing specialist is. And maybe I don't have a year experience with sourcing and recruiting. But have you ever been in a campus org and you were in leadership and maybe you had to help recruit for an event, or you did something with your sorority or fraternity that involves some marketing? That actually is experience. So things outside of the classroom are building experiences that align and complement your degree as well. So when you go through here, they're really only preferred, or actually a lot of them you see as preferred. Again, that's that wish list. There is no really absolutes here, even though it says the 1 year marketing and sourcing and recruiting is required. I don't care where that was done. It doesn't have to be formally done. And this was my occupation. For many years, though my first 2 degrees, I had a degree in therapeutic recreation, and then I had one in speech pathology in undergrad. And so I didn't have any HR or business background, but I knew the industry and I knew healthcare. So that's why a lot of times people will end up in a healthcare HR environment with really no business background, because you know the industry, you know what the medical world may be like just based on your major and maybe doing some volunteering or being in a hospital. So I guess that's kind of the only one I wanted to deal with, those 2. And then we will have this available to other, for you to view after the presentation. So you're able to go in and look at those other cool job titles, from practice manager to outreach technician, pharmaceutical sales, dental clinic manager, human resource assistant. And I love this one, the investigative assistant, and then the Head Start as well. So all of those are bachelor level opportunities within allied health. But again, they're not advertising it as allied health, but your skill set and knowledge base could match all of those positions. All right, so where do you start searching for these postings? We do have Handshake, and all of you have a Handshake account. You simply just use your credentials, your Grand Valley credentials, to get in. If you have not accessed Handshake, I think that will be in one of the resources that we will provide at the end of the presentation. And Handshake is a platform that allows you to search for on-campus jobs, part-time jobs, internships, volunteering, and enjoying some career communities. It is a job board that organizations have to join to be able to post. So it's not a comprehensive listing of every organization out there, but those that are posting there are saying, hey, we want to engage with Grand Valley, we want to hire Grand Valley. So it's a better opportunity sometimes than looking at a big job board like Monster or Indeed, because we know those positions that are posted on Handshake, those organizations have picked Grand Valley to recruit from. Company websites are also a great place to look for jobs. And if you're not quite sure what those companies are, we shared that on the first screen, but we're also going to look at LinkedIn real quick to identify how to maybe start narrowing down companies to look at websites. Indeed, I hear a lot of people say, yeah, I look for my job on Indeed. And it's okay. It's a tool, a part of this whole toolbox that we're talking about. But Indeed is a spider. So what it is it's a job board that actually mines jobs from lots of different companies to put on their website. Usually the first 5 or 6 jobs when you're doing some job searching, organizations have paid to be on there. But other than that, they've just swept. So many times you may have a job on there that the organization didn't even post. So that's why we say usually you can see it on Indeed. It's a great resource for seeing what's open, but then jump back to that company website and say, is it still posted on there? And I would say, then apply through that company's website, but it's a good place to start looking. Staffing agencies is another organization I wanted to bring up to light. We work really closely with Aerotech Scientific, though there are other organizations out there, but that's one that I work with. In fact, the recruiter I work with is an alumni, and he actually helps you find opportunities within maybe his line is pharmaceuticals. So he works really closely with Pfizer. So maybe you don't know anything about Pfizer, or you don't know anything about pharmaceuticals or labs. Well, what he does is he already has contracts with organizations, and he's able to say, hey, I need talent to put in those roles. So he's kind of the middleman. He's going to help you figure it out, help to interview you, get you prepped, find out opportunities. And what I like about it is it's really building some short-term experiences to build and make your resume stronger. It's also good maybe for a gap year. Maybe you want to dabble in the lab industry, but you didn't have a whole lot of experience. It'll allow you to get some experiences there. And then there's really no commitment. So sometimes there's 6-week opportunities, sometimes they're year opportunities. It's another great way too to get what we call get your foot in the door, where you're able to maybe get into an organization and then get hired in, and then you can move around within those companies as well. So it's a great place to kind of start with a little bit of low effort on your end. And then the Career Center as well, we're here to help you maybe identify some job titles. We have lots of connections too. Part of our role is to provide some our role is to develop employer relations. So we're able to pass those on for you. We can't place you in jobs, but we definitely can connect you to some of our contacts as well for you to follow up with. And then the last thing we'll kind of go through real quick here with looking for those job postings is we're going to look at LinkedIn. And I think this is probably the most useful site for allied health science. I only brought this one, the allied health science majors that are on Grand Valley's LinkedIn page. So for those of you who use LinkedIn, you can access this. For those of you who don't have a LinkedIn account, you would need to create one. LinkedIn is free and you don't have to pay for it to utilize this, but this is our best snapshot of what actually all of our allied health science majors are doing. That have graduated, our alumni. We have a pretty big sampling here. We have 23,000 or 2,366,000. And we could kind of go through, and I call this professionally stalking. So we may look through, Grace, you just want to scroll down first just to kind of take a brief snapshot. We're going to see people have done a lot of different things and have gone in a lot of different directions, from masters in public health, PT, biostatistician. All of these individuals that we're looking at, their foundational degree was allied health. Some stayed at allied health and then went on for a career. Others went on for an advanced degree. So it can help you even look at what other degrees are out there that maybe I didn't even think about. And I know I want that advanced degree, or maybe I do want to just look at what can I do with a bachelor's. So we're going to hone in on Spectrum because they are our biggest employer for allied health majors or alumni. 185. And I do want to highlight just a couple. And I got to look here. We were going to look at Laura first. And Laura is a health educator for the Michigan Department of Human and Health Services, what I just talked about earlier. And hopefully we can open her up. I know LinkedIn doesn't always want to cooperate with us. And so we're going to look. Currently, she's a public health consultant. So we would think she probably has a master's in public health. But as we look down, she was a health educator, she was a phlebotomist, she did a student intern, and she was a resident care specialist. So what I love about this is we get to look at somebody's career path. I can also see her education is allied health science. So she basically worked, and everything that she did built upon another experience that led her to where she was. So again, this is a great way, because maybe you want to reach out and ask her, how did you get that job? Or do you have any advice of what I should do maybe to get something like you did? So it's great to do that informational interviewing. And now we'll take a peek at Danielle, and then hopefully she's on here. Well, actually, let's look at Robert, since Robert's right there. Sorry, Grace, you want to scroll down? I love Robert's story. Robert was allied health science. I think he was pre-PA and didn't end up going that route. Now he is that talent program specialist for Spectrum, which is now Corewell. We can see his progression. He started out at Mary Free Bed, and he was actually a volunteer. And his first footprint at Mary Free Bed was a volunteer. And then when he did not get into a program, he thought, what could I do? So he started then as a nurse tech, actually then moved into a recruitment assistant, even though he had no experience, but he knew the culture, he knew the organization, and he was able to grow in that. From that experience for 3 years as a recruitment assistant, he then transferred into Spectrum. So he was then an executive recruiter, and now he's a talent program specialist with outreach and engagement. I think that all happened within about 3 or 4 years from when he was actually in that recruitment role to Spectrum. And so right now, I love Robert. We bring him in on a lot of panels that we do. He's a great advocate for our allied health, but also to help you even get connected in the system, understand how to work through maybe Spectrum. It's a big organization. It's nice to have an alumni. So this, again, you can reach out to Robert through that feature of being able to connect on LinkedIn. But again, we can see his path. He worked his way up within that organization, even though he has no HR background initially, formally education, but within that volunteering all the way up into now he's at Spectrum. All right, and then maybe one more, Grace. We want to look at either Danielle or Taryn. Okay, so Taryn is an operations specialist. Again, that's one of those things that when you come to us and say, what's a job title? And I say, well, the job title could really be a lot of different things, and I can't necessarily give you one. And this is an example. She worked out, let's go down to all 5 of her experiences if we want to click there. She's been at Spectrum for 15 years. And we can see her progression. Again, she started out as a unit aide. Within a couple years or 5 years, she then was a surgical support, to that administrative assistant, to a project specialist, to now an operations specialist. So many times you're going to start maybe in that entry-level position, but the room to grow within those organizations are huge. And those job titles really could be a lot of different things. So getting your first experience in that entry-level job can help you grow within an organization in those non-clinical roles. You're still helping people, you're still helping an organization, and you're still in healthcare. You're just not that first point of contact for a patient. And I think that's all we'll look at for the LinkedIn. And then onto you, Meg.
Yeah, so I'm muted, look at that. So now we're just going to transition into some skill building opportunities that you might be looking for. So Stephanie just went over some different jobs, and you might be looking at those positions thinking, gosh, I really am interested in these. I'd like to maybe explore these further. But sometimes when you start to look at job postings, you might be like, oh, okay, I think I need some skills, or I think that there's some space where I can grow professionally while I'm in college. And so we have some opportunities that can help to support your allied health sciences degree. So within allied health sciences, if you are a general allied health sciences major, you might be picking up a minor, or maybe you're already on the track where you're pre-PA or pre-PT or something like that. So these are different opportunities. We're going to talk about some academic opportunities, and then we're also going to talk about some more outside of the classroom experiences that you could have. So first off, you'll see strategic electives that are listed there, and I put all these links in the chat as well. So the strategic electives, these are opportunities where you can take courses that might be beneficial to you within your career path. So they're just skill building classes. These can be just one class that you fit into your schedule. So this is a great opportunity where you can talk with your academic advisors to figure out, hey, do I have some room in my schedule? And could I take a class that could help me build some skills that might benefit an employer one day? So for example, you might be an allied health sciences major, and maybe, let's say hypothetically, you're a psychology minor, and you are interested in going into human services work. taking the nonprofit grant writing course might be a great opportunity where you can learn the skill of grant writing. You might have the opportunity to actually write a grant within the class that could be used in the future, but you're going to get that skill set. So then when an employer asks you maybe about your something unique about you, you can say, I've taken this class, here's what I've learned in the class, and then you can apply it to the position that you are currently interviewing for. So you can, through that link, you can actually see that there's a list of classes that you might be able to fit into your schedule. Sometimes there's prerequisites, so you can talk with your academic advisor about if that class would fit within your schedule. Hopefully it will. And that is one option that you can do. Another option would be to do a minor. So within Allied Health Sciences, if you were to do the general track, you could choose a minor. We know students will choose minors for a variety of reasons. One, it could be that was your previous major before. And so sometimes it makes sense to transition that once previous major into your minor. It could be that you have just an interest area in that subject matter and you're transitioning to that. It could be that you're looking to add a technical skill. So sometimes we will see Allied Health Sciences students who will pick up maybe a marketing minor because potentially they're looking to work in a hospital setting and they would like to be in the marketing department. A marketing minor along with that scientific background, that would be a nice combination for students that are looking into transition into that non-clinical world. You can gain experience within kind of both industry areas, which is really helpful, and you can sell that to an employer. Minors are a great way to add another skill set if you have the time. Sometimes students are concerned that they don't necessarily have enough time to add a minor. In Allied Health Sciences general, a minor is required. So that is a space where you can do that. But if you are concerned, maybe your Allied Health Sciences pre-PA and your course load is already pretty full. Another option would be, like we talked about earlier, the strategic electives, but badges are something new that Grand Valley is offering. And so badges is a series of courses. It could be, maybe about 3 or 4 courses that are grouped together. And these are courses within a subject area. So you could get a badge in an area. So it would be less credits that you would need to do, but it's almost similar to a certification, not quite a certification, but you are taking courses kind of in an aligned area. And you could add maybe a different area, a different skill set. So actually, Grace, could you click on the badges? I know we didn't talk about this earlier, but just to showcase what students could do with that. So if you scroll down a bit, you will see there's different undergraduate and graduate badges. But this would be a place to check out to see if there's some coursework that you might be interested in adding to your Allied Health Sciences degree. So it's going to support your Allied Health Sciences degree and just add and diversify some of the skills that you have. Thanks, Grace. And then next we'll talk about, after this slide, we'll talk about internships, but internships are it's a great addition to any Allied Health Sciences major, getting that healthcare experience within your field. If you have the opportunity to do an internship, we really encourage students to look into this. Rachel is going to talk a little bit more about this opportunity, but internships are an option where you can work. You might be doing it for credit or not for credit. We'll talk more about that. But you're working in your industry, you're gaining experience, even if you're just in the environment, you're networking with people in your field. If you are looking at your resume and thinking, gosh, I need some experience, an internship is a great way to do that. It can help to fill in some of that white space on your resume, but then also now people that are professionals are training you, right? So they are learning more about you. Internships often lead to full-time positions because if you think about that from the employer perspective, you're already partially trained, they already know you. So it's a great, like Stephanie said earlier, kind of a foot in the door, but that first opportunity within the professional world. The volunteering list that I included in the chat. So this is a list of volunteer healthcare opportunities, and there's actually virtual opportunities in there as well. So we know that sometimes there's limitations. Your schedules are a little bit crazy. You might not have transportation. So that list, and actually Grace, if you want to click on that too, I know I'm adding clicks that we hadn't talked about before, but I think this one is a good visual to show you. So you'll see that red box there. There's a virtual volunteer and healthcare listserv that you can look into. So that's one option. And Grace, if that one doesn't click, that's okay too. So you're going to see this Google Doc listing of different places where you can get connected. We've had students, I think I had a student working a crisis hotline that she found through this listserv, which is really nice for her application into nursing school. Right, and if we go back to the previous page, if you just hit back there, Grace, I think it'll take you back.
Yeah, I'm just going to jump in here too, Megan. I really love the virtual. Even if you're
Yeah.
applying to a program, this adds value. So even if you're not quite sure what direction you're going, getting these virtual opportunities adds value to as a candidate for a professional or grad program or to an employer, because virtual, the world right now, especially telemedicine, and then working in a mental health capacity. A lot of these healthcare opportunities with a virtual volunteer have to do with mental health. So those are two big areas that we know we have a big need in. So that's why I love these. So it's easy for students to do, and yet you're gaining so many great experiences that add huge value to you.
Definitely. If you scroll down, Grace, so what I wanted to show everyone is if you keep scrolling a little bit farther, there we go. If you see this big grid, we have this kind of nice, easy to access listserv where you can search by category and you can see if it's paid or a volunteer opportunity, the organization, and then it'll connect you back to the website. So if you are looking to get some healthcare experience, and this can be great if you are thinking, okay, I'm going to be applying to a program and I want to get some healthcare experience. So let's say you're getting this experience because you are planning on applying to graduate school for, let's say, PA. These clinical and non-clinical experiences can be beneficial whether you are going into clinical or non-clinical. So let's say your plan is to go clinical. If you get non-clinical experience, that is such an important part of the healthcare industry to have an understanding of, and vice versa. So we encourage any student who is applying to a clinical program to get clinical and non-clinical experience. And for a student who's non-clinical, if you have some tech role experience and some non-clinical, just think of what value you are bringing to the company, that you have an understanding of both ends of the organization. So that can be really important, and again, help to build that resume. All right, so we'll go back to the slide. I mentioned earlier, part-time employment has really been kind of a space where we've been able to get students more opportunities. Obviously, COVID had limited some things, but employers now are also looking for a lot of workers. And so if you are having a hard time finding healthcare experience, come talk to us, but we will be doing a healthcare experience panel, or a how to gain healthcare experience event, I should say, next winter as well. So we try to bring in employers and they are looking to hire. So if you're looking for some opportunities, please attend those. We also have some previous recorded sessions that we could also share with you if you are interested in learning more about those employers. We do a lot of career events at the Career Center. And so please feel free to check our website, and then also follow us on social media. That's another place where we often will feature, if an employer's hiring, we'll post that, or if we have an employer event coming up, we'll list it there. And lastly, research experience. Research experience, we know that students, a lot of times you're interested and you're not exactly sure how to get started. So one thing would be just to really know how to market the research classes that you're taking. And so being able to articulate those projects that you're working on, talking to an employer how you did a lit review, how you ran statistical analysis, how you identified community needs. Those are all really great skills that you're learning within your research classes. But then additionally, you might have the opportunity to do undergraduate research. So if you are working with the Office of Undergraduate Research at Grand Valley, they might be connecting you with a faculty member, reaching out to a faculty member and asking, hey, do you have any research that you're working on? I would love to be a part of that. They might be able to either take you on their research project, or they might refer you to another faculty member that's doing things, or it might even be outside your discipline, and that's also okay too. So you're still going to be gaining those foundational skills, and you're going to be working cross disciplines. And so that's another valuable skill to have, especially in an interdisciplinary team like a healthcare team. Right, and Rachel's going to talk with us about internships next.
Awesome, thanks. So with internships, I think Megan did a great job of talking about why they are so valuable. And we kind of use the word internship a little bit more general when we think about what it is. It's really an opportunity for you to get some experience in the workplace related to what it is that you're studying or what those future career goals are. So it's a great opportunity to test out some different ideas. So all of those different career paths that Stephanie was talking about, maybe you're thinking some non-clinical routes are going to be some things that you want to further explore. looking at those organizations are great, great ways to see if that is going to be a good fit, or if that is an environment that you think is going to be a place that you'd want to, continue on after you graduate. So, so with internships, you're getting that experience, you're getting that exposure, you're meeting people in the field. And you're definitely developing skills. So there's always value to that. And you might be crossing some things off your list, which is totally fine to do too. So that can help you to narrow it down. A couple of things just to mention about internships that I think can sometimes be confusing is, do I have to get credit for it to count as an internship? What do I call it on my resume? Some of those different things there. When should I do it? When it comes to an internship, you can actually do it either for credit or just for the experience itself for most of the allied health students. And I'm going to also refer to Professor Davis, who's here, because I know she approves these. So sometimes an employer will call an experience an internship, but it really might not fit what the department would consider to be an experience. So if you're thinking that, I would love to get credit for this, maybe apply it for an elective, you still definitely want to refer back to your academic area just to make sure that it does fit the different check marks in their buckets that they're looking for. So, so there are certain things that you do want to kind of keep an eye out for. You want to make sure that it is related to what you're learning in the classroom, that you can see how it would apply for what your future career goals are. And so kind of making a case for that. Like I said, you don't necessarily have to get credit for it. So if you do just want to explore that as a career option, maybe you don't need any additional credits. You've done all your electives for your program, everything else. So you just really want that experience. That's fine too. You can definitely still add that to your resume. It'll help with that experience and that skill set, like I had said before. If you do want to do the credit route, using it as an elective is pretty typical then for allied health. You do actually register for a class. So you don't just do the experience. You do have to register for AHS 490, and there'll be some different assignments that you'll do throughout the semester, although the bulk of your work will be done at your internship site. Yeah, go ahead.
One thing I just want to mention about internships is that if you're thinking about an internship, reach out to me first so that we can kind of have a conversation about it. You know what you're looking for. We have a really broad kind of definition of how we define internships, but what we don't want you to do is just like something like a data entry type of position. We really want you to be able to utilize the skills that you're learning in the classes that we're providing. And so we just have to make sure that whatever role you pick out, that it'll be appropriate for an AHS student. So just be mindful of that piece. And you can't register for the class until you've actually talked to me and I've approved the internship, because we do have a prior approval process that's in place for those courses. So if you're interested, please reach out to me. Also, of course, Megan, Rachel, and Stephanie to answer like any preliminary questions, but if you have specifics for the AHS program, reach out to me. Also, we want to make sure that you've had the majority of the core classes in AHS before you do an internship. So that's usually you're in your junior, senior year when you're doing internships. So definitely like those 100 level classes, healthcare management, law and ethics. We want to make sure you've had some of those core classes, maybe not the capstone yet, but definitely our core, more of our core lower level classes before you go into an internship, so that you do have that strong healthcare piece before you enter into an internship. That's all.
Yeah, that's great. So yeah, typically these classes are an internship would be completed your junior, senior year. I will say that it is helpful to give yourself plenty of time to look for these experiences. Not employers' timetables don't always fall in line with our semesters. And so if you do want to get credit for an experience, then you do have to make sure you're giving yourself plenty of time to search for that, to apply for that, and then to get all of the required paperwork from Grand Valley's end in order to get registered for the class. So from the registration deadline, you want to give, I think it's 8 weeks. You want to have that in place. Alicia, is that right?
We've decreased it. We talked to health compliance and we got a little bit of a little bit of flexibility there. So
Good.
we're at 6 weeks now,
Okay.
but it has definitely been 8 weeks for quite a long time prior to that.
So yeah, so a good rule of thumb is to think at least a semester in advance for these, if you can give yourself that amount of time, if you're looking to get that academic credit component. And again, that's beneficial if you have some room in your schedule, if you have an extra elective that you want to take, or maybe if you're just know that you do better out in a hands-on work experience versus maybe sitting in a class. An internship can be a good alternative for that. When it comes to actually looking for that experience, that's where the Career Center can really come into play, and we can help you in terms of identifying different options, identifying different experiences. And when it comes time to seeking credit for that, that's when you'll connect back with Alicia and the academic department for that experience. So Grace, if you want to jump to the next slide. There are a lot of different ways that you can go about applying for an internship. And the first is just kind of getting some of those ideas. So all of those places that Stephanie had talked about in terms of opportunities to look for jobs are all the same places that you could potentially look for internships with. A lot of organizations will post internships right with us through Handshake. They might post them directly on their organization's website, or they might not post them at all. And so you just have to reach out directly to those organizations, talk to them about opportunities, talk to them about what you're looking for, what you feel like you might be able to bring to the organization. So doing some of those connections that Stephanie had referenced through LinkedIn is not only a great way to identify some different ideas in some different places, but it's also a great way to start inquiring about some of those kind of hidden opportunities. Internships can be a little bit elusive in that way, where you might just actually create an experience because there's an organization that you'd be really excited to work with. That's not uncommon at all for that. So don't be afraid to start reaching out and to start connecting out with some of those organizations. The career guides is just another tool just to see what some of those other organizations and job titles that's available through our website. We do have Experience Matters as well, and that's just a place where students have kind of blogged, I guess, about their internship experiences that they've had. So they just go through and answer some questions about where they interned, what they did. We always encourage other interning students to add to that. So if you've ever done an experience, would love to see it on there as well. That can be a good tool. Mentioned Handshake and LinkedIn. One thing I will say about Handshake is, you know, when you see any employers that you are interested in potentially working with, start following them in Handshake. What's great about that is then the system will let you know when something gets posted from that employer. So then you're not in there constantly having to search through and sift through all of the other jobs that are in there. So, so for example, if you're interested in Blue Cross Blue Shields as maybe a potential place to explore, you can follow them in Handshake. Anytime they post a position or register for an event with us, you'll get a notification for that. So it's just kind of a nice way to stay up to date on what some of your kind of more favorite employers are doing. And then networking and events, again, are just great ways to connect out with employers, just to explore those opportunities, but then to also actually inquire about internships. That's why we hold those. That's why the employers come to those. So those are great conversations to be able to have when you're looking for those internship experiences. The other thing just to note about internships is that, you know, employers don't always use the word internship. So you might actually see some of those part-time job experiences, and maybe you can get credit for that experience depending on what it is that you're doing. Or maybe that's just the hands-on experience that you really need to add to your toolkit, to add to your skill sets, to help broaden your experience in general. So it's okay if it's not necessarily called an internship. Again, that's kind of a general term. So you just have to kind of think through as you're looking at some of these maybe part-time experiences or, you know, other volunteer roles, if that's really going to help propel you forward in advancing some of those skills and advancing some of those experiences. And we can help with some of that sifting if you're kind of unsure about that. But all of those other resources that Megan and Stephanie had referred to are great tools to use for internships as well. So if you want to jump to the next one, just a couple extra things to consider around internships. Health compliance is something that, depending on if you're getting credit for this internship, you usually do have to go through health compliance just because you're most likely be interning within a healthcare organization. And we just want to make sure that you're going into that safe and protected from anything that might be there. So there are some check boxes that you have to go through with health compliance that can take a little time. That's why you need to give yourself that 6 to 8 weeks if you can before registering for your internship. Any specific academic requirements, that's where you can refer back to the Allied Health website. It kind of hits on, all of those things that you'll want to make sure to keep in mind. You've hit those prereq classes. Depending on how many hours you'd be working within your internship would depend on how many credits you can earn for that. So most typical would be a 3-credit class would be working about 150 hours within your internship for the course of the semester, which it's about 10 to 15 hours a week, depending on when you can get started there. So some students will do that during a semester, like a fall or a winter. Some like to do that over the summer because you just have a little more time. So you can kind of fit that in with what works best with your schedule. Megan had also mentioned, looking at minors to complement what you're learning in your allied health program. And you can actually look at internships as part of a minor as well. So most minors do allow for internship to be counted as an elective towards a minor. So that could be another way that you could look at potentially getting some additional experience to support that. And then the other thing just to mention is if you do find yourself in an unpaid internship that you're getting credit for, we do offer a couple of scholarships for that through the Career Center. So we have our Career Center Internship Award where we do $500 scholarships to 10 students every semester. And then we also now have a similar type of a scholarship for first generation students. So you'll find the applications for those on that website there through the Career Center. So something just to kind of consider as well. I know sometimes an unpaid internship can be really tricky to do because you have so many other things going on, and so adding that into a schedule can be sometimes kind of tough. And so hopefully these scholarships can help a little bit with that. The big thing, just to remind folks, is when you're thinking about an internship, this is where you're able to test out some of those opportunities. So thinking about your interests in general, thinking about, what's important to you in the work that you do, and what are you sort of already skilled in, and what are you want to further develop, finding that sweet spot in the middle of all 3 of those can be really helpful. So I think Megan had given some great examples of that. If you find that you're really creative and you have, really interested in working in the creative area, really enjoy, educating people on different healthcare issues that are going on, maybe looking at a public health way or a marketing department or something along those lines. So there's lots of different ways that you can apply what you're learning in such a variety of settings. And it's nice to be able to test that out within a 3-month window where you don't have to feel like you're overly committing to anything through an internship.
I was doing it. Okay, I know we're getting time is kind of running out here, so I'm going to quickly go through this. If you are getting ready to graduate in December and you feel a little bit under experienced, I'm just going to kind of go through these things. Evaluate your transferable skills, and those transferable skills are what we call maybe soft skills. Maybe you worked in or had a student org that you were part of and you developed leadership skills or recruiting skills or those marketing skills. Those are transferable skills. Those are skills that you've gained in an environment that we can use in other environments. So think about that. Think about the areas of your life that you've built skills and how could I use that in a different industry, but the same skill set could be used. Build and diversify skills and that you'd like to pursue. So we looked at those job descriptions. Go through those job descriptions and think, what do they need here? Do they need technical skills, writing skills, communication skills? Do they need, again, a lot of those softer skills will be outlined in a job description. So you can kind of take a peek at that and see how can I build those. Focus on building your network. Talked about LinkedIn, reaching out to alumni, letting them know I'm getting ready to graduate and building my network. Would love to know about your career path, how you got your job. That is showing interest in what they did, but also networking. And who knows when they can come back and say, hey, send me your resume. We may have an opportunity for you. Take that entry-level position to gain experience. It's okay if it says that, they don't require a bachelor's, because that's usually the preferred, but maybe not required, but it is your opportunity to get that first opportunity within an organization to help you grow. Attend career events. And then we talked about utilizing Handshake and LinkedIn.
Okay, and for some of you, you might be thinking about making the transition outside of healthcare. So you might have this allied health sciences degree, and maybe you've been thinking, I just don't know if that's the route I want to go. And that is really okay. So yes, the word health is in the title of your degree, but it can transition to a lot of places. So you want to think about what are those transferable skills that you've talked about. And you might be thinking, gosh, you guys have mentioned that a lot, but there's really a lot of value that you're gaining from the classes that you're taking. And so we want you to see how well you can apply your degree all these different places. But with transitioning outside of healthcare, we want you to start looking at alternative industries. So it can be really hard to think about, a specific job title that you might be looking for. And if that seems really hard, start with industries. And actually, so through the Career Center, we have our career communities. And so career communities is a way that students can learn about other opportunities in different industries. And so we have a STEM career community, we have the healthcare career community, we have communications in the arts. So all these different routes that you can go with your degree. So what I would recommend is feel free to join the healthcare career community, but then also join the other career communities. So we really designed this for students to be thinking about their major beyond just their major, but more so actually the industry that they could be transitioning into. So feel free to choose more than one. You can almost think about career communities as like a little bit, we've compared it to, if you like to shop at Old Navy, right, you can go to our career community website and you're going to get information there. But then also we will send you tailored information to each industry almost on a bi-weekly newsletter. You're going to get a newsletter basically a couple times a month, and it will talk about things that are going on campus, off campus, employers that are looking to hire, different networking opportunities that are coming up. We'll try to give you tips in the field or different news related articles. So it's really a passive way where you can just get information. So you're just taking in information, but it can help you to use your degree in different industry areas. We also want you to practice telling your story without leading with your major. And I know that might sound a little bit negative. So let me explain what we mean. If you are thinking about switching industries, starting at, let's say you're at a career fair and you start with, well, I'm an allied health sciences major. What do you have for me? If you are looking to go into marketing, for example, employers don't always know what's going on at the college level. So you'll have to articulate your experience to the employer to help them understand, oh, this is how my experience translates to your industry. And so rather than leading with, I'm an allied health sciences major, you can start with, I really took a lot of research classes during my major, and here's where I learned how to do some investigative research. I learned to identify sources. I learned to connect ideas. So you want to lead with some of those experiences, or perhaps that you've been working that part-time job. And you actually start with, we had a student actually who was a waitress, and then she had allied health sciences and wanted to go into sales. So she really focused on her sales experience that she had. And she got hired. So she started to lead with her skills, and then talked about too how her degree aligned with that, with the experience of sales, and then also with the employer. So you want to just make sure that you can articulate your experiences. And if you need help with that, we coach students through that all the time at the Career Center. You can stop by our career lab hours, which are drop-in hours, or you can set up an appointment with us. Another thing I wanted you to consider is Odyssey planning. This might not be a term that everybody is familiar with, but Odyssey planning is essentially giving yourself the space to come up with 3 different career ideas, 3 different pathways that you could pursue. So it could be, hey, this is the plan that I have. So this is the initial plan that I was thinking. And maybe that's, I'm going to do allied health sciences and I'm pre-PA, and my plan is to get into PA school. That's great. Now try to think of a plan that's different than that. And then think of another plan that's different than that. And allow yourself to be open-minded with that. Sometimes students just haven't given themselves the permission to think about other career paths that are different than what they started off with freshman year, but there are lots of opportunities. You're a different person than you were a little while ago, right? Hopefully you've learned and grown and your skills have expanded. And there's positive things that come with that. I know sometimes there's some sadness thinking about your career plans not going entirely how you had planned, but there's a lot of good opportunities that come with these changes and shifts. All right. And then we just had one more slide. We wanted to let you know about some of our additional resources. So we have our Work Like a Laker podcast. We'd encourage you to listen. You can listen anywhere where you get your podcasts. So we have a few episodes on internships, but specifically there's one on how to find an internship. We have our recent episode on clinical versus non-clinical healthcare careers, where we actually interview someone who is outside the clinical realm. They're more non-clinical. Then we have an episode on Odyssey planning, which I had just mentioned, and then parallel planning and why you should be doing it. So you can listen to the podcast. We also have parallel planning appointments and group sessions that you can attend. And then I'm going to drop in the chat. We have a clinical and non-clinical checklist that you can take a look at. And so it just kind of walks you through what you would need to do if you were transitioning. Sorry, I'm just trying to multitask here. If you were thinking about pursuing a clinical career path or a non-clinical career path. And then we also have a wealth of resources on our Career Center resources page. So you'll see those links in the chat. And then I know that we're running out of time right now. We're at 5 o'clock on the dot. So please feel free to follow up with the Career Center. You can connect with Stephanie and I. You can drop by our office. We have our career lab. So Rachel, Stephanie, and I all work our career lab hours from 11 to 4, Monday through Friday in the Allendale office. And then there's also even virtual hours of career lab from 4 to 7. We'll help with any career questions and resume concerns you might have. So otherwise, I know we're short on time. We're right at the dot. So thank you very much for coming today. And we look forward to working with you. And actually, I can hang out if anybody has questions. I can hang for a little bit too.